Thank you everyone for joining and for being patient with us. We will be starting in just a minute with our speaker in this second COVID-19 webinar series of the Vural Center for Global Islamic Studies at George Mason University. I think in order to be mindful of everyone's time, we are going to get started. Welcome everyone. My name is Ahmet Selim Tekedoğlu. I'm a research fellow at the Vural Center for Global Islamic Studies at George Mason University. And I'm also the editor-in-chief of the Meydan.com, the online digital studies scholarship platform of the Vural Center for Global Islamic Studies at George Mason University. It's so nice to see all of you with us, including many friends. Our speaker today in this program, which is the second speaker in our COVID-19 and Muslim Religiosity webinar series, is Dr. Donna Auston from Rutgers University. Our first speaker was Adnan Zulfikar from Rutgers Law School. So we have two Rutgers speakers in a row. And for those of you who are interested, we just published Dr. Adnan's talk last week at the center's Vimeo account. Similarly, so this program is being recorded, and we would like you to keep that in mind in the Q&A session. If at any point anyone feels uncomfortable, we'll be in touch. Our speaker today is Dr. Donna Auston from Rutgers University. As I have mentioned, Dr. Donna Auston brings to us her background as an anthropologist, writer, and activist, whose body of work focuses primarily on race, ethnicity, gender, religion, media representation, and Islam in America. Her dissertation research explored Black Muslim activism and spiritual protest in the post-Ferguson Black Lives Matter era. And she has many written book chapters on the historical contributions of African-American Muslims in the arts, culture, and social justice movements, and the connections between Islamophobia and Black Lives Matter. She teaches currently at Rutgers University, she is a member of the recently formed Black Muslim COVID Coalition. Dr. Donna's bio is on our website, and we are really blessed to have her expertise, her voice with us today, with the very apt title, The Pandemic of White Supremacy, Making Black Muslim Lives Matter in a COVID-19 World. We'll get started with Dr. Donna in just a minute, but before, I wanted to mention a few housekeeping notes for all of us. Today, we are going to be, as always, supported by our programs coordinator at the center, Aisha Nursam Maskara. She will be posting reminders and a few links in the chat room. And if you have any questions, you can private chat her and me, so we can try to resolve any technical issues, any other issues that you might have. We ask that you please keep yourself on mute during the program. And please try also refrain from private chatting with our speaker during her speech, so that she is not distracted. During the Q&A portion of the event, you will be able to either post your questions on the chat box, or if you use the raise hand button, we will be able to unmute you so you can ask your question. So hopefully we'll do another reminder before that. But without further ado, I want to get started with one more announcement, which is that in the series that's going to run through the fall semester, next on July 14th, we have Dr. Dietrich Rietz from Free University at Berlin with the title COVID-19 and the Missionary Work of the Tablighi Jamaat in South Asia. And then on July 28th, we have Andre Stanton from University of Denver with Lived Islam and COVID-19, Belief, Piety, Practice, and a Digital Turn. But today we are really grateful to Dr. Donna for making time for this. And without further ado, I'm leaving you with her for her talk, The Pandemic of White Supremacy, Making Black Muslim Lives Matter in a COVID-19 World. Dr. Donna.
Thank you, Ahmed. It is, and thank you to everyone who has logged in. It's wonderful to be here this afternoon. Hopefully we'll have a good and fruitful discussion. I want to talk a little bit about the ways that Black Muslims in the US have been managing amongst themselves and for their communities, the crisis, the pandemic crisis. And I want to talk about this in a way that brings in the role of white supremacy and Islamophobia, both not as, often when we think about these phenomena, or when we hear these words, we think about them, as interpersonal, perhaps, phenomenon, in terms of hate crimes or street harassment, which of course is one element of it, right? But I really want to spend some time unpacking the structural nature of both of those phenomenon and both of those ideologies, and thinking about how they are playing out in this moment and how Black Muslims are responding to those social realities. Also, I want to extend upon some of the research that I've done in my dissertation, which really examines the ways that that Black Muslims draw upon, both, inspiration from their cultural backgrounds, but also from their religious backgrounds, and marshal the ethical resources within both of those realms in order to deal with the material conditions under which they live, right? My dissertation research examined the ways that that Black Muslims were showing up and engaging within the context of the Black Lives Matter movement. So post-Ferguson, so from about 2015 to 2016 or 17 is when I conducted most of the research, right? And many of the people that that are featured here are the groups that are the work of the people that are featured here are people that I work with in my dissertation. But I do want to sort of highlight some of that. But first, what we're going to do, I think, is what's important to do. And if you can go ahead and put up the screen share, we can get started moving through the PowerPoint presentation. I'm just going to try to use some visuals to anchor the discussion. There's some images and some concepts that I want us to think about as we go forward. So if we can post the screen share, that would be helpful. So this is just the title, right? So, and I just quickly to say about the title, like when I talk about the metaphor that I'm using here in terms of thinking about white supremacy as a pandemic, I want to be clear that what I'm arguing here is not so much that it's a pandemic in the sense that that it's, a random, disease or contagion that one might catch by chance. Because white supremacy as an ideology structures and orders the world around us in very systematic and deliberate ways, right? Pandemic here for me is really about the ubiquitous nature of it, right? And also something of a nod to the deadly nature of it. And this is something that I'm going to get into in the coming slides, right? White supremacy has real material impacts. Though feelings and emotions are a part of how it gets deployed and enforced, it's not primarily about, racism is not about feelings per se, right? Not only about feelings, right? It actually has real material consequences. And I want to talk about some of that. If you can advance to the next slide. So I want to start my discussion here. I don't know, I'm sorry, I don't know what happened with the formatting, but these two pictures here, there are two images, one of an African-American woman on the left and one of an African-American man on the right. The two individuals pictured here are Breonna Taylor and George Floyd. Some of you may be familiar with these names from recent events. Breonna Taylor was an African-American woman from Louisville, Kentucky, who was killed by police in mid-March when police executed a no-knock warrant to her home, which is basically where police can, without having to knock on your door and wait for you to let them in, actually just sort of bust in. So they hit her door, her front door with a battering ram, entered her home, and her partner who was there with her, of course, was alarmed because there's a bunch of armed people entering their home. He shot at the police officers. the police officer shot back and they killed Breonna Taylor. This happened in mid-March. So this is right around the time, I think in most parts of the country where the COVID-19 crisis started to really hit, things started to shut down. I know that's about the time that I went on, my university went on spring break, and we were starting to quarantine. Breonna Taylor was an essential worker, and she's a paramedic. But what's happening here, and what's one of the things that's interesting about her story, is the fact that, you know, within the context of this medical crisis that we're experiencing collectively, and the role that she played as somebody who was working to keep people safe in terms of healthcare, she as a Black woman is subject to the violence of white supremacy in the form of police violence, right? George Floyd, of course, many more people know his name, I think, even within the context of everything that's happened since then. George Floyd was the man at the center of the Minneapolis controversy. He was the Black man that was killed in front of the bodega or the corner store by Minneapolis police officer Derek Chauvin. He was, you know, with the knee to the back. He had the light, you know, had the breath squeezed out of him, right? While everyone watched on video, which of course set off a chain reaction, both in Minneapolis and in cities across the country about, you know, eruption of protest in response to police violence. And I bring him into a conversation about COVID-19 for a couple of different reasons. One, of course, it's really interesting that the way that the violence of white supremacy operates is that it forces Black people to think about protesting, gathering in crowds in large numbers in the context of highly contagious respiratory disease, right? But the alternative, of course, is that, like Breonna Taylor, they might be killed anyway. And she was killed in her home, right? But also it's interesting to think about because when the autopsy was done on George Floyd, what we found, one of the things that was discovered was that George Floyd had, in fact, contracted COVID-19, survived it, only to be killed by a police officer on the street for allegedly passing off a counterfeit $20 bill. And so those stories, I think, are interesting anchors to begin to guide to the discussion to help us to understand the ways in which Black life is constrained by white supremacy, which manifests itself both in the way that the pandemic is being managed and also, you know, within the context of other types of state violence. If you can advance to the next slide, please. So what is white supremacy, right? At bottom, right, white supremacy is, again, as I said earlier, it's not just about what we might imagine, hate crimes, right? The Ku Klux Klan and other types of white supremacist extremist groups as sort of the, you know, the ultimate manifestation of white supremacy, but it's actually more pervasive and you know, more, you know, it's everywhere. It's more structural, more foundational than that, right? It's not fringe. It's something that orders every part of society. And that includes, of course, the way that, you know, access to healthcare, that includes access to educational opportunities, that includes access to the, you know, to political participation, all sorts of things. And so I wanted to start us off with the words of Charles Mills, who is a Jamaican philosopher who theorizes a lot about white supremacy. He talks about white supremacy as a political system, as a particular power structure of formal or informal rule, socioeconomic privilege, and norms for differential distribution of material wealth and opportunities, benefits and burdens, rights and duties, right? And of course, this is going to be very relevant for thinking about how and whom has been most impacted by COVID-19 in the United States. And that, of course, has been poor people, racial minorities, Black and brown communities particularly. And so the Black Muslim community has been impacted in ways by COVID-19 that are disproportional to the population by virtue of the fact that they're marginalized according to the logics of white supremacy. He goes on to say, white supremacy is a particular mode of domination that's rooted in the state's legal structure and civic culture. White supremacy also encompasses de facto as well as de jure white privilege and refers more broadly to the European domination of the planet that has left us with the racialized distributions of economic, political, and cultural power that we have today, right? So this is a very systemic phenomenon. And one of the things that's important to think about how this works in relationship to Black Muslims is not only are they impacted by white supremacy, but they're also simultaneously impacted by Islamophobia, which is very much tied to anti-Blackness in the United States at its foundations. Of course, in the US, the first Muslims that are brought to what became the US nation state are enslaved African Muslims. And so this logic, this grammar, this social grammar that emerges for dealing with Black people and in many ways, right, regulated cultural practices of the enslaved, including religion, right? Islamophobia develops very much in tandem, right, with, you know, a straightforwardly phenotypical racial project, but also there's a cultural racial project that goes along with that. And this is how Islamophobia begins to develop, particularly in the US. You can advance to the next slide, please. Right, and so what's at stake here, again, is not just feelings or interpersonal interactions, but it's actually a life and death matter, right? Ta-Nehisi Coates, who is a well-known writer, most famously for The Atlantic, and has written a couple of books as well. In his essay on Donald Trump's election, the essay is called Donald Trump, the First White President. That was written in the immediate aftermath of Trump's election. He talks about the ways that white supremacy is foundational to the United States. And he says that racism remains as it has since 1776 at the heart of this country's political life. And to accept that whiteness brought us Donald Trump is to accept that whiteness is an existential danger to the country and to the world. And so that sort of fleshes out in a little bit more detail what I mean when I employ the metaphor of pandemic, right? For application to this concept and this ideology and how it operates globally, right? It's not just about adverse interactions between individual people from different races, but it really speaks to the ways, the various ways that white supremacy controls access to life and death. And within the context of a pandemic, right, well, you know, that means that there's a large gap, you know, in, you know, how people are able to care for themselves and care for their families and care for their communities when there's a deadly virus on the loose, right? You can advance to the next slide. So briefly, you know, I'm invoking here on this slide a saying that is common in many African-American communities that points to the nature of this disparate impact. You know, and this did not emerge in the context of COVID-19. I've been hearing this my whole life, right? Or, you know, for most of my life, right? It's, you know, sort of a folk wisdom, right, that circulates in many of these communities. And the saying is, when white folks catch a cold, Black folks catch pneumonia. And the idea here is that whatever is adversely impacting mainstream white America, that is going to have compounded impacts on Black Americans because of the nature of how white supremacy orders, again, this access to resources, healthcare, material, you know, jobs, whatever, et cetera, right? And so we're seeing this playing out in very, very stark terms across the country. I mean, the data on COVID-19, of course, is shifting rapidly. And, you know, who's impacted, the numbers, all those sorts of things are shifting very rapidly, right? Even just this week, right? I live in the New York area, and I live in New Jersey specifically. We were hit very hard early on. Our numbers are going down quite a bit have gone down quite a bit here, but we're seeing an increase, a dramatic increase in places like Texas and Florida and Arizona, right? So the numbers are shifting. This data is current as of a month ago, right? And it's a very quick visual that gives you a sense of how this is disproportionately impacted Black communities across the country. Basically, what you have on the right and the left are visual illustrations of the number of positive cases of COVID-19 I'm sorry, that's on the right-hand side. And then you have the deaths on the left-hand side in the graphic. And it's color-coded, right? So you have, according to the map here, it shows how each state, where the most disproportionate impact is on Black communities, right? Where it's the heaviest. So in places like that are coded in the dark orange, like Maine, New Hampshire, Iowa, Missouri. In terms of the cases, those cases, they're seeing the numbers of African Americans and Black people impacted at rates highly disproportional to their percentage of the population. And then the other states are at varying degrees of that. The lighter orange, the beige, the gray, look at, but you can see, taken as an aggregate, most states in the United States have some degree, some more than others, but they have some degree of disproportionate impact on their Black communities, both in terms of cases and deaths, right? And this is something that when it started to become clear that, COVID-19 was a real global threat, that it was going to, hit the United States, because for a long time at the beginning of the year, it seemed like it was just sort of contained in China, and we didn't know how or if it was going to hit us here. But once it became clear that it was in the United States and it was going to start to spread, many of the activist organizations that I was in touch with in the Black Muslim community, it's like we knew immediately before these graphics were available, before anybody knew, our communities are going to get hit the hardest. Why? Because when white folks catch a cold, Black folks catch pneumonia, right? We know, and there are a number of reasons that we knew we were going to be more vulnerable, right? And these are all structural factors in the way that anti-Black racism plays out. The way white supremacy operates, that means that we are more likely to be essential workers like Breonna Taylor, right? People who don't have the luxury of working from home. We know that we're overrepresented in the prison system, right? Which are places, of course, with close people in close contact. They can't escape, generally don't have, the access that they want or need to hygiene products and being able to keep themselves clean. They don't have a lot of control over that. There's a lot of disease and death in prisons, period, right? Outside of pandemic conditions. So those are, of course, disasters that were waiting to happen. We're also, because of the ways that medical racism plays out, our communities are often experience higher levels of what we call pre-existing conditions, diabetes, hypertension, asthma. And these are all related to structural factors, or are related to not just access to medical care, but they're also related to oftentimes Black communities have less access to healthy, nutritious food that's affordable and accessible. Black people are also more likely in this country to live in close proximity to various types of environmental toxins, which can lead to conditions like asthma and cancer and other sorts of things, right? So our communities are experiencing higher rates of chronic and debilitating pre-existing conditions anyway. So we knew with the introduction of, of a highly contagious, deadly virus that, that our communities were just going to get hit harder. And we had a sense of this. And so a group of Black Muslim activists came together, seeing this on the horizon, and said, there's something that we need to do about this. We need to organize our communities, marshal our resources, and try to figure out ways to help our community weather this storm. And that's what happened. Can you advance to the next slide, please? So just to step back for a second. So as I mentioned before, just to say a little bit of something about the Black Muslim demographic in the United States, I mentioned before that the first Muslims in the US were Black Muslim enslaved Africans, right? that this fact and the way that the system under enslavement was designed in terms of, making sure that people remained in bondage and servitude and bondage. There's a way that Islamophobia developed in close connection and an intimate entanglement with anti-Black racism, right? And so those things are intimate, and we can talk more about that in the Q&A, right? If you I want to flesh that out a little bit. The Black Muslims are roughly 25 to 35% of the U.S. Muslim demographic, and that includes a range of ethnic backgrounds, national origins, sectarian expressions of Islamic faith. So you have African Americans who we traditionally conceive of as the descendants of people who were enslaved in what is the United States, but we also have Afro-Caribbean Muslims. We also have Muslims who are more recent migrants with more recent roots in the African continent. Either they're immigrants or their parents are immigrants. So it's a very diasporic, Afro-diasporic type of grouping. And so when I say Black Muslims, I'm including all of these. And the coalition is in fact reflective of all of this. So there's also Sunni, there's Shia, there's Nation of Islam, right? All of those various expressions, right, are included under the seemingly simple but incredibly internally diverse label Black Muslims, right? And as I mentioned before, this is a population that is doubly marginalized, right, by virtue of both race and religious identity, subject to police violence, state-sponsored faith-based profiling, surveillance, but also the full range of other types of structural impediments to health and wellness that exist by virtue of their identity as Black people in the United States, right, that we talked about before. If you can advance to the next slide, right? And so I want to talk about activism among Black Muslims in the present day. I want to also just make a quick linkage, and again, we can talk more about this in the Q&A, right? But what I observed, not only under COVID-19, but also as thinking about the research that I conducted for my dissertation, as extensions of earlier instantiations of Black Muslim activism that actually took engagement with the adverse conditions created by white supremacy across the spectrum. And that means everything from the psychological impacts of white supremacy to the material conditions of white supremacy, as a way, as a target that they engaged constructively with the ethical resources provided by their Islam, right? What do I mean by that? I have here on this slide, of course, a picture of Malcolm X. And Malcolm X in this photograph, taken in 1962 in Los Angeles. In Los Angeles in 1962, there was an incident with the Nation of Islam where a member of that mosque by the name of Ronald Stokes was shot dead by Los Angeles police, right? And so this problem of police brutality is not new. It didn't start in Ferguson. It's a decades old issue, right, that has been plaguing Black communities, but it's also something that Black Muslim communities in the US have been engaging with for at least a half a century, actually really more than that, closer to a century, right? In a formal and organized way. And so the activism that we see in the marshaling of resources and the organizing that we see around police brutality, COVID-19, I'm thinking about these as very intimately connected, interrelated issues, as we saw in the lives of Breonna Taylor and George Floyd. Black Muslims in the present are drawing upon a tradition created by their predecessors in this land, such as Malcolm X and others who have, and there are many others, right? He's just probably the most famous example, who have been drawing upon their Islam and using their Islam and crafting their Islam, not just sort of, and when I say Islam, it's not just the pre-packaged, set of rules, regulations, beliefs, but actually the contents of Black American Islam are actively shaped by the engagement with white supremacy, and on a variety of levels, right? That's in things that we would call activism, but it also impacts the content and the relationality to eschatology, to theology, to ritual practice as well, right? But the important thing here is really a direct engagement with white supremacy as a moral obligation, and as a religious mandate is how Malcolm X entered into his faith, and how he practiced his faith, and how that shaped his career. But it also sort of impacts and shapes and informs the ways that Black Muslims are engaging with this particular crisis, that is exacerbated, helped along, right, by COVID-19, also by police violence, but really underlying all of this in the way that these two things are playing out, and dynamics of how they are proceeding, right, or have everything to do with the way that white supremacy already operated before COVID-19 was a thing, right? So if you can advance to the next slide, please. So this brings me basically to the heart of the talk, and to the last thing that I'll discuss before we begin to open it up for question and answer is the work of the National Black Muslim COVID Coalition, and all of that I was leading up to this slide, right? I wanted to give some background and context for understanding where something like this comes from, right? Because it's like, oh, okay, yes, that's nice, but what does that have to do with, what's the significance of it? And I hope that the previous discussion will help us to understand a little bit better, how and why something like this matters, and, what's the significance of the work that's being done here, right? So as I said before, the National Black Muslim COVID Coalition is not yet 6 months old. It emerged, basically in mid-March or mid to late March as a grassroots effort that was anchored by two existing Black Muslim organizations that had already been doing work for years in the Muslim community, but really drawing upon those pre-existing networks of activists and community leaders to devise intervention and to strategize around interventions, ahead of, or somewhat ahead of, or in conjunction with, right, the coming, tidal wave that everyone saw on the horizon, right? So it's a grassroots, interdisciplinary coalition of Black Muslim activists, professionals, artists, community leaders, etc., that was formed to address the specific intersectional needs of Black Muslim communities during the pandemic, right? So everyone from, community organizers, imams, chaplains, Black Muslim, poets, medical professionals, of course, mental health professionals. I mean, we have some of everybody involved here who, basically trying, because we figure, just the nature of what's likely to happen here, you're going to need all hands on deck. And this crisis is, the thinking was that this crisis is certainly going to impact all of these various areas of our lives. So we need people who have, knowledge, expertise, resources, etc., working on each of these different areas, right? We needed our medical professionals for sure to be the faces that were providing information on the virus that nobody had ever heard of before, what to do about it, what was so alarming about it, how to take precautions, how to protect yourself, what types of treatments might be available, because there's a long history, of course, because of the way that white supremacy operates and has been operating in our communities for a very long time, is that one of the barriers to good healthcare for Black people is mistrust of medical professionals and institutions, because our communities have not always experienced care at the hands of the healthcare industrial complex. And it's very important to have for us to have medical professionals who we trust, who our community trusts, to be able to provide good, solid scientific information to our communities. Because people are, of course, maybe, and there was general anxiety. Everyone was experiencing anxiety because nobody knew what COVID-19 was, or, nobody knew what to expect. But there's also sort of, okay, how do I filter through this information as a Black person who comes from communities where the Tuskegee syphilis experiments took place, right? Or, where medical malfeasance happens, where Black women are still experiencing much higher maternal mortality rates, right, because of institutionalized racism within healthcare settings, right? So getting our Black Muslim medical professionals, to talk to our communities directly, specifically, not, and to provide culturally relevant, competent information, right, through lenses that our community would respond to, was a priority for us. And so this one picture that's here in the corner is a screenshot from the National Black Muslim COVID Coalition's one of the webinars that was held early on, that was basically giving the community just basic information, what we knew at the time about the virus, what we knew about how to protect ourselves, what we knew about what the challenges were likely to be, getting out the message of quarantine. This was ahead of Ramadan, so we hadn't, we're trying to figure out how we were going to, what Ramadan was going to look like when you couldn't be physically in the company of people, right? So all of these different things, right? Some of the, this picture right above it is a screenshot from an article of news coverage that was done on some of the activities of the coalition. This article explored how this coalition was serving the communities, right? And in this particular, it starts, by talking about another webinar that the coalition put together, is just ways of thinking about planning for wellness, right, as Black Muslim people under COVID-19, right? That was the discussion with a variety of experts that weighed in for that, mental health professionals, but also others, right? So thinking about wellness is, one of the things that Bell Hooks argued was that, as Black people living under white supremacist capitalist patriarchy, Black people are not supposed to be well. Like, wellness is a luxury that's not necessarily afforded to or extended to Black people. And so talking about and strategizing and thinking about wellness from a Black Muslim perspective was something else that, another information session that the COVID Coalition offered. So these are the types of discussions that were taking place, and that were, we're thinking about how to serve our communities, right, best in this crisis. The coalition was anchored, as I said before, by two already well-established organizations that are both led by Black Muslim women. Muslim Wellness Foundation, which was founded by Dr. Camille Rashad, who's a psychologist, and the Muslim Anti-Racism Collaborative that is founded and still run by Marguerite Hill, who is a longtime community organizer. And the Muslim Anti-Racism Collaborative is primarily an organization that focuses on anti-racism education within the Muslim community, right? Actually addressing, they do some outside work, but a lot of their resources and content are directed towards addressing the problem of anti-Blackness and racism, intra-Muslim racism, right? Because of course, as we know, the Muslim community is very ethnically, nationally, linguistically, racially diverse internally. And those various segments of the community don't always behave in ways toward one another that, that reflects an anti-racist spiritual orientation. And so they've been doing work for the last several years around this. And so these two organizations came together as sort of the anchors for this project, as a way to, bring just bring others into the orbit, right, of the organizing, the strategizing, and the marshaling of resources in order to serve Black Muslim communities throughout the COVID-19 crisis, right? And so some of the areas of concern, as I said before, medicine and health, mental and emotional wellness, economic impacts, of course, one of the devastating ripple effects of this health crisis has been the economic impact numbers of, so many millions unemployed or underemployed, unable to find work. And of course, that impacts your housing, that impacts, so all of these impact your quality of life along a lot of spectrums, and certainly make people more vulnerable potentially to the immediate scare, right? Which is the virus itself. Like if you don't, for example, if you don't have access to good food, right? It becomes more difficult to stay healthy and virus free, right? In addition to all of the other problems that creates, or you lose your health insurance. And if you do get sick, and you don't have a job, or you don't have healthcare coverage, how do you get well, right? In the middle of a pandemic, right? And so all of these, areas are areas of concern that were being addressed by the coalition. Also, culture and community disruption. On the along the lower bar, there's another story that talks about another webinar that the coalition sponsored, which was really around, and this was earlier on as well, but thinking about particularly when we understood that the elderly were among part of the population that were predicted to be the most vulnerable to sickness and loss during the COVID crisis. What does it mean for our cultural continuity as Black Muslims if large numbers of our elders are killed by this virus? And so how can we think about preserving the stories of elder Black Muslims who we very well might lose in the coming months to this deadly virus, right? So there were all sorts of ways that this coalition was strategizing around, trying to keep the community together and to provide guidance, resources, et cetera, during, everything that was starting to trickle in, all of the effects that were starting to show up. But also, of course, spiritual guidance, right? Again, as I mentioned, this was before Ramadan. So one of the most immediate things was, this is of course the time when most people are in the masjid, they're in the mosques in the largest numbers, and everybody looks forward to this all year. And now all of a sudden trying to convince, for example, masjid administrators, imams, etc., to go virtual, right? Because, in some places there was resistance to that. People, well, how are we going to do Ramadan if we can't be together? And is Ramadan valid? And what happens if we can't have Taraweeh prayers? And, and there was real anxiety around that. So one of the things that the coalition tried to do was to really, convince people that this was something that needed to be done. Because of course, you don't want people in your congregation getting sick and dying over this. But it was a switch. I mean, and it required talking through. And so one of the areas that the coalition also sought to contribute to was to try and help communities make that adjustment, right? Help with that learning curve so that people experience some continuity, strategize alternative ways to be together when they can't physically be together, right? And just ways to make sure that the community the various needs of the community are being met in some way. Because of course, what happens when you are a marginalized community, often not only are you more vulnerable just because you're more vulnerable, right, for all of the reasons that we've already discussed, but one of the things that that also happens is that the resources that tend to be developed, because they can't see you in the first place, because you exist on the margins, that the resources developed don't necessarily have you in mind. And so they're not necessarily developed for you or for certain specific needs that you and your community might have. And so the Black Muslim COVID Coalition sought to fill this gap, right? And is still active and working, and, because we're not out of the crisis, of course. And so I wanna basically wrap up there, right? And, open the floor for question and answer, and we can talk more about all of these things or some other things that are connected to this discussion. But I want to leave you with the understanding that what we're seeing here in terms of the activities of the coalition, right, that I argue build upon earlier instantiations of Black Muslims engaging with white supremacy in particular, and all of the various offshoots of it that work to create adverse and deadly material conditions for Black people, Muslim and otherwise, is that one of the projects of Black Islam along these lines has really been about creating worlds that are fundamentally of a different type, where the logic of white supremacy as a deadly fact of life does not rule the roost, if that makes any sense. In other words, so creating spaces or trying to create a world where Black death is not inevitable, and is not the outcome or the most likely outcome, right, of the way that the world is ordered, trying to create a different world, right, where Black wellness, where Black thriving, right, and Black flourishing might actually be possible. And of course, that is a huge undertaking. It's a big project, but my argument is that this is one of the primary engines that has motivated and been a distinguishing feature for a number of decades now of Black Muslim activist work and organizing. And this instantiation of it, under the current twin crisis of COVID-19 and a renewed attention on police violence of various types, is in fact a continuation of that project. But it's an attempt to build a brick in that particular wall, right? Which of course is a very long, arduous, and ongoing process, right? But it is one that is fundamentally, I think, motivated a lot of Black Muslim work and organizing over the decades. So I want to stop there, and I look to taking your questions.
Okay, wonderful, thank you very much, Donna. This was quite a treat for all of us in the meeting. So what we will do is, as you take a breath, what I am going to do is I'll go through the chat. I see several questions posted over there. So I'll start in the order that we received them. In the meantime, again, we invite you to use the raise hand button if you would like to rather ask your question live, so we can unmute you and invite you to ask your question. So the first question that we see, Donna, is a question from Dr. Shaban Amir, and I'm happy to report that she will be joining the webinar series later in the summer. I believe the date is August 11th, but please stay tuned. So she asks, what resources and other forms of support are most needed by the Black Muslim COVID Coalition for greatest outreach and sustainable success?
Yes, so you can primarily, material support, donations, we take all of that. If you go to, on that last slide, the website was up there. The website is blackmuslimcoalition.com, blackmuslimcoalition.com, it's all one word. You can find more information about what we do and how you can support is there, but I would definitely say, that's one primary way that people can help. If they're also interested in perhaps getting involved, please, reach out and contact the coalition. And, if there's something that, a skill set or something, or volunteer time that you have that you can, and that, that you can give toward the effort, we're happy to sort of consider that as well. But I would go to the website, and that will give you a very thorough overview of what we do, and that may give people specific ideas about how they might want to plug themselves into supporting the efforts.
Thank you. And we just posted the link on the chat
Okay.
for everyone's ease. Wonderful. Second question is from Shakil Said, and he asks, obviously, unlike a vaccine, there is no cure against racism. There is no vaccine a vaccine can be found against COVID-19, but there is no cure against racism. The question is, should we be seeking cure in another legislation, or is it something else? Can we legislate our ways out of racism in America?
Well, no, but Dr. Martin Luther King famously said that the law cannot make a man love me, but it can keep him from lynching me, and that, you know, that matters. You know, so legislation is one way, right, that racism is in fact addressed. But because racism and white supremacy literally infect, if I may like go overboard with this metaphor here, but they really impact and shape fundamentally every single institution that you might think of. So if you work in corporate America, racism is shaping the way corporate America is operating, both in terms of its internal employment and promotion and other sorts of, you know, practices, depending on what kind of company it is, to the products that they put out, to, you know, I mean, just everything, right? So wherever, my advice to people when this sort of question comes up is like, you don't have to go over to, I mean, you know, of course, obviously legislation impacts all of us. You know, these things that are our civic duties to be involved in real ways, right? We should all do those things. But also, wherever you are, there's racism. There's racism if you work in healthcare. There's racism if you work in a university or a K-12 school. There's racism, like, take your pick. It's everywhere. And so it is really up to, it's in media, and the media products that are produced. You know, I mean, there's a long history, for example, of overtly and covertly racist television programming and advertisements. I mean, you know what I mean? So all of these not only are produced by racism, but they tend to reproduce more racism, right? And so figuring out whatever spaces that you work in or are close to where racism is happening, and I guarantee you again that it is happening at a theater near you, figure out how to intervene, right? Because we need all sorts of interventions in this particular crisis, because it's literally, I mean, and I say this like, I've said this publicly before, like, it's literally in the water that we drink. If you think about, for example, a place like Flint, Michigan, it's literally in the water we drink. So there's no shortage of work that needs to be done around uprooting, like identifying, uprooting, and eradicating white supremacy wherever it exists. Thank you
for that. Next question that we have is from Noma. I'm sorry, I'm not saying your last name. The question is, most Muslim doctors visibly present are either South Asian or Arab. Will most of them be willing to realize the racism against Black patients? This is a problem that stems back to education in medical school, isn't that the case? Mm-hmm. That's the question.
Yes. Yeah, because there's still like, yeah, I mean, that's again, like, even sort of connecting it to the last question. It's a huge problem in medical training. As far as I know, most doctors and other medical professionals they don't have to have explicit training in, you know, in race and race relations, and certainly not how it impacts or potentially impacts their medical practice. So you have, for example, I mean, there's so many ways that this plays out, right? So for example, ways that Black patients tend to not be believed as often when they present with symptoms and say, okay, hey, well, I'm in pain. And so there's a whole lot of ways that ideas about Black criminality and Black untrustworthiness might present in a scenario like that. So if I say that I go to the hospital and I say, hey, I can't breathe, or hey, I have COVID symptoms, and particularly early on in this particular crisis, where, you know, I mean, at least where I live, testing is a whole lot more widely available now. But, you know, tests were being doled out like very strictly in the beginning. if I, you know, say, hey, listen, I lost my sense of taste, or I have shortness of breath, or I have symptoms, and there were definitely reports that Black people were being turned away at higher rates to even be tested and diagnosed, right? You know, there's so many studies that indicate that, you know, Black patients are administered anesthesia at much lower rates than other patients from other racial backgrounds, right? Because there's this idea that for whatever reason, there's a large percentage of medical students who really believe that Black people don't feel pain in the same ways that other patients from, you know, white patients or other. These things can actually, in fact, directly impact care. So South Asian, Arab doctors, you know, non-white, but also non-Black medical professionals are not exempt from anti-Black racism. You know, there's no guarantee that because the person might also be minoritized themselves in various ways, that they will not operate in accordance with, you know, anti-Black ideologies. And this is a huge problem in the Muslim community. And this is one of the, again, one of the primary purposes of the Muslim Anti-Racism Collaborative has been to address this within, I mean, I know not all South Asians are Muslims, and you understand that, but you know what I'm saying? But understanding that within these communities that are minoritized as a whole, there's also, you know, intra-community, you know, discrimination and weird beliefs that do play out. So my advice to South Asian medical or Arab or other brown medical practitioners is the same advice that I would give to, you know, to white ones, which is, you know, check your racism, right? And actually do the work to educate yourself on how racism operates, both in society more broadly, but definitely within the medical profession. That includes something as basic, to be honest with, but I imagine that a lot of people don't know. For example, that like the very foundations of American gynecology, right? Dr. Marion Sims experimented on enslaved Black women. So the whole foundation of the, you know, I mean, it's like, I mean, they were both forced labor for his clinics because they were enslaved, but also they were forced patients. And this, so American gynecology literally rests upon the violation and violence committed on Black women. So you know, it's, so coming to terms with what that means. I mean, you know, is important for every medical professional. And I guarantee you that a large percentage of people practicing medicine don't know that. And he's not the only one, by the way. So it's like, you know, so really, I think everyone needs deep education and a deep willingness, because education alone actually doesn't cure the problems. The person has to have a willingness within themselves to be different. And a lot of times that means making different choices, because it requires people to divest from the privilege that they have, even if it's relative privilege. And so maybe as a, you know, a Pakistani background doctor, like, yeah, I may experience some discrimination, but I'm actually, in relation to a whole bunch of other people in society, I have class privilege. I have, you know, I'm sort of a model minority. So I'm a minority, but kind of like I'm the good kind, right? So I'm shielded to some extent from the worst effects of the system of white supremacy and anti-Black racism. And I need to be willing to divest myself from those privileges in order to do the work, right? So education is one component of that, but there also has to be a willingness to say, you know, I'm not going to participate in replicating this. And that may mean I have to give up some stuff.
Indeed. I just wanted to add that, you know, at least, you know, here in Philadelphia region, Black Doctors COVID-19 Consortium actually was the more trusted party, and they went to several churches and mosques to do testing in the heat of the pandemic. And that made a difference. I'm sure we'll come to some of these themes again, but let me just quickly go to one of our colleagues here at George Mason. Kevin Stoy says, thank you for sharing your time and expertise with us, Dr. Auston. He says, I really appreciate how you've situated these complex challenges as part of a larger system that consistently oppresses and marginalizes certain communities, much more so than others. And his question is, I am teaching a course this fall to students at George Mason on science literature and unintended, is in parentheses, consequences. Is there anything you suggest my students might read that would motivate them to engage and become agents of change? Science literature and unintended consequences, or intended. I think some of the work on medical literature that you highlighted is very relevant as well.
Yeah, there's a there's a book. Deidre Cooper Owens wrote a book on Dr. Marion Sims. The full title is, I'm gonna like scroll and look for it while I'm talking. But her name is Deirdre Cooper Owens. She wrote a whole book on Marion Sims and obstetric racism. I, as an anthropologist, when I'm teaching, I'm sorry, I'm trying to walk and chew gum at the same time. When I'm teaching students about how racial knowledge is produced across society. So it's, of course, it's legal, it's this, it's that, right? So I teach from a number of different perspectives. And one of the things that I typically do is to talk about the ways that science, in particular anthropology, because I'm an anthropologist, has directly contributed to racial hierarchy. So that includes, Samuel Morton and the discussion of scientific racism. Samuel Morton, for those who may not know, he's a founder of the University of Penn's Medical School. But he's an anthropologist who is considered the father of scientific racism, and measuring cranial sizes and bone structure and that sort of thing to allegedly extrapolate conclusions about relative intelligence between the races and that sort of thing, right? So any work that sort of deals with, Samuel Morton's life and work, I think is good. There are a bunch of others that I could probably recommend if you, the organizers have my email. I could maybe recommend some other specific resources if you email me when I'm not trying to do two things at once. But the book that I mentioned is called Medical Bondage, Race, Gender, and the Origins of American Gynecology by Deirdre Cooper Owens. That's a very good place to start. I mean, I don't know how much you may want to assign parts of the book or all of it or whatever, but it is a very good resource that delves into that history. But again, I find that the conversation about scientific racism is a very good place to start, because it sort of pulls back the myth in some ways that science is quote unquote objective, but actually in this case very much complicit in the production of racism. And the validation of racism, right, from a quote unquote scientific, standpoint. So I think those sorts of resources are very helpful. Again, if you email me, there's some other titles, because I also in my dissertation and at the various points referred to, and I can't remember right now off the top of my head the names of the studies, but they're shorter articles that also deal with, for example, the disparities in perception between patients that might present in a healthcare setting, being administered anesthesia at lower rates, right? And there are actual studies that measure this, right? So there's a lot of literature, even if you just do a search, you like in terms of those sorts of racial disparities, literature on maternal mortality rates that are racially based, right? All of these things, and I would also recommend readings on, the Tuskegee experiments, for example, right? And the ways that that the medical industrial complex has, in fact, I mean, these are, you know, if we work in universities with human subjects at all, we know that the Tuskegee experiments are one of the reasons why we have IRB, institutional research board, right? That, you know, like that have to sort of approve our research protocols because of these types of abuses. So those are some places to start. But if you, some of the titles, like if you want specific names, I can actually do that when I have them in front of me. But those are some places.
What I've done is I just sent an email to you and Kevin, so you two are connected now.
Thank you.
Okay, wonderful. So our next question is from Samia Kirchner, and so she says, thanks for your informed passion. And her question is, what is the role of brown complicity in supporting white supremacy, and how can we, in parentheses, Muslim immigrants from South Asia, help tangibly the National Black Muslim Coalition? Also, is there a presence of the Black Muslim Coalition in historically Black colleges and universities? She says, I teach at Morgan State University, and I note that there is a gap across religious groups within African American student body.
Yeah, I would say, you know, again, related to, I think maybe it was 2 questions ago about the brown doctors specifically, right? I think the same basic principle applies, is that people who are in fact themselves minoritized but relatively privileged, right, in relationship to other folks. And I think we all are in some way, right? Even myself, I mean, I'm a Black Muslim woman, and in many ways, like marginalized, but also like I enjoy, for example, like I'm not disabled, so I'm privileged in relationship, for example, to disabled folks who have struggles that I don't, you know, have to deal with, right? So all of us, I think, regardless of where we are, have to figure out ways that we need to, as I said, divest from the types of privilege that we experience in the world, right? So as an instructor, like, you know, when I teach my classes, for example, you know, if I have a student with a disability, I need to figure out ways to not let my able-bodied position make my classroom and my teaching inaccessible to my students who have, you know, certain types of medical conditions, for example, right? If that makes any sense, right? So that means me, as somebody who enjoys privilege in that particular area, I have to figure out the ways that I might be perpetuating that oppressive system that's marginalizing or you know, that's harming someone else, and then divest from it. Like, it means I have to say, I don't want to continue to accrue, you know, ill-gotten gains from a system that, you know, that's generated from somebody else who's suffering, because so that I can live a life of relative ease, and figure out ways to actively not just say, oh, that's terrible, and then go back to, you know, eating my crumpets, right? But actually say, what is it that I need to actively do in order to stop this? You know, Angela Davis famously said, like, it's not enough to not, in a racist society, it's not enough to be not racist. You have to be anti-racist, right? And you can apply that to whatever other vectors of privilege that you might experience. So that's the question about brown. What she said. What was the phrase that was in that question? Brown complicity, I think it was. Yeah. In these systems, like, figure out where you're perpetuating and where you might be aiding and abetting, and stop. Now, about how to, we are a national organization, so we don't have chapters per se, but we do have people from across the nation involved in this particular effort. Some of them may be affiliated with, I mean, we have a lot of members, right? So some of us are at campuses and some of us are at HBCUs. So I would say, again, go to the website, contact us if you're thinking about getting involved in a specific way, and we can talk through the, you know, the particulars of that. But but yeah, we are, I mean, so we don't have like chapters, we're sort of like at this point we're operating as a single unit, but definitely we welcome any and all support that people are interested in giving. So please get in contact with the coalition through the website, and we'll see we'll take it from there.
Mm-hmm. Thank you so much. We have limited time, a lot of questions as always, but we are grateful to all your answers and everyone who is asking questions. There is a question first from Ibrahim Abu Sharif. He was asking about the bibliography available of books and articles that one could pick from and including classes. And Dr. Bigelow kindly posted the Black Islam syllabus by Dr. Kyla Wheeler on the chat. So that includes your own work as well. But on that, I will highly recommend to everyone who's listening to us the chapter by Donna and Dr. Sylvia Chan Malik at the Muslims and US Politics Today edited volume by Muhammad Hassan Khalil. The chapter is very enlightening. That I am assigning in my course in the fall. It's titled Drawing Near to God's Pleasure, a dialogue on the Black Muslim political tradition and the moral ethical imperatives of American Islam. I think it really sheds light on many aspects of what we are listening today. So I'll really encourage everyone to read that. And let me just quickly post the link for the book over here as well. There is one question from Mubina. The question is, are there people working on telling our communities about these abuses, such as, our system is racist, but everything is not a conspiracy? She says, I know so many fellow Black Muslims who are very conspiracy theory oriented, kind of like, anti-vaccine stances, being against wearing masks. And the question continues, it's clear that the medical institutions is anti-Black and they cannot be trusted for a good reason, but that there are things that are real and we should not conflate real and the conspiracy, I think is the point. And I think this is more a comment, but I think it's a reflection on the discourse from within the Black Muslim communities. I think, people who tend to think that the pandemic is overblown and that wearing masks is overblown, that it's only minuscule compared to other pandemics in the past. That kind of discourse, I think the question or the comment concerns.
Well, so I'm of two minds about this. One is that I think you're right on some level, but I think it's complicated, and this is part of what the coalition was trying to, the balancing act that the coalition has been trying to deal with, is that I am not absolutely not going to blame Black people for being distrustful and paranoid of a system that, I mean, come on, like it's not necessarily irrational. I believe, of course, like in the current, based upon all of the information that I have at my fingertips, is that wearing masks and such things and socially distancing are in fact the things that we need to do to keep alive. But I also understand, I absolutely understand why Black people at least, I mean, because there's a whole sort of, we didn't have time to get into that, but there's a whole very interesting racial divide in the anti-mask population in the US, because there's a whole other cluster of anti-mask folks that are really interestingly like adopting the symbols and the stances of white supremacy as a way of talking about why they won't wear masks. And of course, this started to appear specifically, and at least in force and in a very public way, once it became widely reported that Black people were being disproportionately impacted. It was like, oh, well, it's just killing the Black people. Well, we want to go back to getting our hair cut and eating at IHOP, right? So one of the things that the coalition was trying to do was, again, to address through people who are from the communities that we're trying to serve, who are in fact, licensed, intelligent, competent medical professionals to get good information out to our people so that we are able to, that our communities are actually able to sift through, you know, what information is good for them and what information is not. But I think like the whole scolding people, when in fact they have every reason to be paranoid, is quite counterproductive in my opinion, right? And so we have to, you know, I think be careful about how that type of sentiment gets framed. It is frustrating because I don't want to see, you know, my family members die. And I know that my family members are, because of who they, you know, because my siblings are all essential workers, right? You know, I understand that, but I also understand, you know, why many of us are skeptical. I mean, and these are not just historical abuses. This is, I mean, you know, like one of my, there are people who I know, right, in my life, Black people who are economically disadvantaged, who in fact participate voluntarily at this point, right, in studies, pharmaceutical studies, right? You know, spend a weekend, we'll put this, you know, thing on your skin patch to see, you know, if the medicine impacts you adversely or whatever. This is a part of like trials, and because they pay for it, right? They'll compensate you, you know, $1,000 for a Saturday or for a weekend or whatever, so that they can observe you getting this medicine. And I grew up in a mostly Black working class neighborhood, and there is in fact, you know, Pfizer has a whole testing center there that sits in the middle of this, you know, I mean, of course it's rapidly gentrifying now, but it's, you know, a largely Black, you know, economically marginal community, you know, guinea pig. It's you're guinea pigging people, taking advantage of the fact that people are, you know, people need that extra money to make rent or to do this or to do that, right? There's not, so this is now, this is not, you know, 100 years ago. And so people have lots of reasons to, you know, and I think also too, thinking about the way that this pandemic, I mean, it's been, and I know it feels like forever, but it's really just been a few months. And we were dealing with a bunch of rapidly shifting information. Wear masks, don't wear masks, masks don't, I mean, when it first came out, it was like, well, you know, masks are only for people who are feeling sick. So if you're feeling sick and you have to go out, wear a mask. And then, you know, like 2 weeks later, it was like, everybody wear a mask now, or we're gonna start pulling you over and the cops are gonna start harassing you if you're Black and you're not wearing a mask. So I mean, it's frustrating because, you know, there's always in this case there's true and good solid information that's mixed up in all of the conflicting and confusing messages. But I think you have to understand that we have all been experiencing a very steep learning curve with regard to COVID-19, coupled with the complications of so many years of just, you know, the most horrific breaches of ethics in terms of care with regard to Black communities as well. So that means our messaging, and this is part of how the coalition wanted to approach it, is that we wanted to make sure that we tried to provide our communities with good, solid information so that people could make good decisions on how to keep themselves safe. But we have to acknowledge that medical apartheid is in fact a thing, and not sort of dismiss it as like you're just paranoid, because you're not just paranoid. Like that's not what's happening. You know what I mean? So I think, you know, striking that balance is really important.
Yeah. No, thank you so much for that. And I just wanted to mention that on August 25th, we will actually also host Dr. Camila Rashad in this series, where we are hoping that maybe we'll see some glimpses from the survey that I think herself and coalition started to collect. So we are hopeful that will be there. So we are getting close to the end of our program, and I just wanted to say, Selam to Mashad, one of our former visiting fellows from Iran, Dr. Tagavi from the Meshat Political Science Department was with us. So salams to you as well, Dr. Tagavi. One final question, Donna, is from me. Your scholarship centers around race, religion, and also gender. And you've talked a lot about that, but I wanted to ask, do you see any sort of specific Black Muslim women and the pandemic, any specific things coming together? A lot of the activism, a lot of the leadership on the subject is being done by people like you, and that's, and I know it might be early to maybe develop synthesis, but how does the pandemic impact the gender sort of in terms of gender? What are some dynamics on that as we get back to, say, mosques are reopening and there's a conversation around who is going to be re-allowed in the mosque, for example?
So no, that's been interesting, because I know in the beginning when it was still, at least around here, all the mosques were not closed, but they were sort of figuring out whether or not they should close. There was some back and forth. And I know one of the first things I saw was that there were some mosques, at least, that were saying, okay, well, we need to limit the numbers of people who were in the mosque at the same time as a safety measure. But so how we're going to do that is we're going to shut the women out. So only the men can come, like as if they can't catch the virus, and okay, but whatever, right? So that's one thing that I know has happened with Muslim communities specifically. One of the other things, of course, that I think has happened, that I think has been, obviously I haven't had time to do formal research on it, but one of the things I think that has happened is that with the explosion of virtual platforms, right, and virtual ways of being connected in community, there's a lot more access for Muslim women right now to sort of be the public voice, and to, because you can't, in most mosques, right, speaking from the minbar for women is still something that isn't really done. So there have been a lot more, I think, opportunities for Muslim women to lead in spiritual activities and give, religious talks, all sorts of ways of engaging the communities that are generally closed in the ways that we've been operating in terms of space. There are all sorts of other dynamics that, that I think are affecting life for women in their working lives, and other dynamics, particularly with the crunch, the childcare crunch, and when the kids are not in school, and sort of the division of labor within people's homes, and who gets to work in peace and who has to shoulder the additional burden of making sure the kids are schooled and fed and that sort of thing, and the cooking and the cleaning and all that stuff like that. I think that's having a really interesting impact, and not just in Muslim communities, but I think that's having a tremendous impact in, I know I've been seeing reports, for example, that some academic journals have been reporting in the last several months that their submissions for women have been way down, right, from women academics, and, part of what people are suspecting is at work here is this gender division of household labor that has suddenly quadrupled for people who are at home all the time, right? And so so there are, I think, a number of ways that I don't know right now if there is a widespread gender disparity in terms of who's getting the virus and who's, I don't know that yet. It would be interesting to know. I don't know how thoroughly authorities have been collecting that sort of data, because I know, like in the beginning, for example, in many places in New Jersey at least, and other places, like people had to push states to collect racial data, because was like, we know this is going to be a problem, but they weren't initially looking at it. It was just like, oh, you know what I mean? So it's like, so I think it's something that we certainly should keep a longer eye on to see how it plays out over the long term. But those are some of the things that I've observed, immediately.
Thank you so much, Donna, for this. This has been such a treat for all of us. I see many comments in the chat box. Everyone is thanking you, finding this really helpful and relevant, and wishing that many more institutions would host you. I also want to draw your attention to the links that my colleague, our program coordinator at the center, Ayşe Kara, has posted to the center website, to our social media accounts, and to the Vimeo page, where a recording of this talk will hopefully appear in about a week. And please sign up also for our events. Our next event in this series is going to be on July 14th by Dietrich Reitz on the COVID-19 and the missionary work of the Tabligh Jamaat in South Asia and beyond. And then by Andrea Stanton, we have Shaban Amir with us, Dr. Camila. So many talks in this series. I also want to encourage everyone to also check out the Maidan. We will be publishing some of the videos and some of the other content over there as well. Donna Auston, Dr. Donna, thank you so much again for joining us. Thank you to all of you in our audience for joining. We look forward to being together again soon.
Thank you.